So, well, first of all, thanks for doing this, man. I appreciate it a lot.
Happy to be here.
And Joe, good afternoon.
Good afternoon.
Not good morning.
Is it afternoon?
Or morning. Or is it evening?
I don't know. I lost track of time.
And what is time?
It was dark when we started this.
Did you lose track of
Dark
space?
again?
No, we're fine.
Oh.
Yeah, it's getting light up. Yeah, we didn't even think about lighting with this perspective. Anyway, okay, so we're here today. We're going to talk about the implications of exercise on the immune system, and specifically, how does it impact your immune system for better or for worse? Okay, and with us today we have Caleb Holtzman, a resident, a physical therapy resident, to be exact. And we're very grateful to have you here and to share your thoughts, your perspectives, and who you are. So why don't you go ahead and introduce yourself and discuss what you are, who you are, where you come from, what you want to do, everything like that.
Sure, yeah. Thanks for having me. Caleb Holtzman, like you said, graduated physical therapy school at University of Illinois, Chicago this past May 2020. So we had a virtual graduation. Pretty interesting way to go out. We got our clinicals cut short in March, but thankfully we were past the limit that CAPT set to be able to graduate and that sort of thing. So we finished our classes online, graduated virtually, and then passed the boards in July. My original plan was to do travel PT. But that whole industry was kind of kaposhed by COVID. So luckily for me, the residency program was kind of more of an afterthought for me, but it's been such a blessing in disguise to have it. You know, most residencies you do have to apply in the fall for the next year. Luckily for me, this residency was, the application deadline had not passed yet, so I was able to apply and then come down to Southwest Florida, Fort Myers, and start the orthopedic residency. It's been great.
Okay, great. We're glad to have you, man. I really enjoyed your interview. Thought you're an excellent candidate. It's really, really important. It's of the utmost importance that we're not only helping you pursue this level of greatness that you see in yourself, and the endless possibility of what you can do, but it's also very important to build a relationship with you, be friends with you, and build that rapport relationship so that we, in essence, not only does it help you grow, but it also helps us grow.
Mm-hmm. It's pushing the profession forward.
I hope so.
Yeah.
I hope so. In that point, why did you choose a physical therapy residency? It's optional right now within our career. You don't get paid any extra, especially when you're doing it.
You get paid less.
Yeah, exactly right. And so right now there's no advancement for it. Why?
The main thing is the mentorship. That's the key piece. That's the main sell, at least for me. Coming out of school, you're a generalist. You're a general physical therapy practitioner where you can work in acute care, outpatient, any different setting that you want to do. So coming out of school, you had we had 38 weeks of scheduled clinicals. I think we completed 34, which is great, you know, but you only get so far. And then when you're treating your own patients, you know, you still have, you know, confidence to gain and the efficiency and everything else. So having that one-on-one mentorship with the residency program from a skilled clinician who is also an OCS, orthopedic clinical specialist, they kind of help guide your thought process to be able to think more critically, more efficiently within sessions and get to your diagnosis, prognosis faster and better. So it's just a really good transition out of school to, it's almost like a better and more focused clinical rotation that you would get in school that you now get as you're working, getting paid, starting your career. So it's just a really good segue from school to the workplace.
Okay, I can certainly understand that. I remember my first year of practice, and it was, throw you in the fire, and you're like,
yep, a little chaotic.
Yeah, what do I do? So, and then there's a lot of life lessons that, if not for that, I don't know if I'd be as seasoned as as you give me credit for, but or our other mentors. But they are our mentors and faculty are phenomenal.
Yeah.
And again, this was initiated and implemented to better the profession, but not just the profession. Most importantly, was to provide the most up-to-date, evidence-based, creative and innovative solutions for patients, for people. When I'm 60 years old, 42 years old, I hope that I have the level of expertise that's cutting edge enough to help me with whatever ailment or condition I may be suffering from. That will help me get on my feet faster and live a great life, a life of quality as opposed to quantity. So that's the initial goal. The second goal is to cultivate physical therapists who lead that charge and change life, not just professionally, but personally, for the better, for the most optimal reasons. And we were talking about history of physical therapy before, and the people that came before us were trailblazers. And I don't know if you're aware of this, but they actually intentionally, when they formed their own societies and charters, they were not physicians. These initial physical therapists intentionally used a scientific format to scrutinize their treatments and compare them to patient outcomes with other therapists in hopes to see what actually works and what doesn't. And they didn't have to do that. At that point in time, in the 1800s, that wasn't something that was thought of. Nobody really...
It was pretty experimental at that point.
Yeah, and as authority, you go to the doctor and you do what the doctor says. But these trailblazers, they figured out right away what was important. And that's something that I would say, coincidentally enough, is innate within all of us. Some of us express it more than others. So to hear you talk about it, there is no difference between you and the so-called guru. There is none. What limits you is you, your limitations. And so you can be as great, you can be as complacent as you want to be. And it doesn't matter. It just depends on what you want. And I think you're going to do great things. And I can't say it as a fact, but I just have a good feeling about you in general. So I'm glad you're aboard. Okay. Do you have any other insights, any other passions that you want to pursue or embark on or talk about?
Passion is a big word for Saturday morning. I do. So one of my life goals is to be bilingual. I do want to be learn Spanish and be able to diversify my clientele. Be able to treat potentially marginalized populations and help that. Because I do think physical therapists have social responsibility to be able to treat not only people who can do cash-based and everything else, but also the people who need it, who can't afford it or don't have insurance or that sort of thing. So we do need to, as a society, reach out to all members who can benefit from our services.
So you're a bit altruistic with your profession.
A little bit.
What about you though, personally though? Like, what is there anything you particularly enjoy? Anything that you want to embark on that's not a part of the profession, or that could be a part of the profession, or what else makes Caleb?
Well, I do like exercise. General exercise. I play a lot of sports. When I came down here, I learned pickleball. My first week down here. It's pretty big for the Southwest Florida population. I have some coworkers that say it's a old man sport, old person sport, not too young for that, but no, it gets pretty competitive. It's pretty fun. Rollerblading, hiking. I like downhill skiing. Just being outside and moving. I like soccer. Big Liverpool fan.
Okay.
And where were you raised? Where did you come from?
Originally from St. Louis, Missouri.
Okay.
Yeah,
There's a lot of good therapists that come out of that area.
They have St. Louis University's there, WashU, and then Maryville University. There's I think three maybe four physical therapists,
Top 50.
physical therapy schools
Yeah,
in
you're
St.
right.
Louis.
But yeah, you want to have fun with life, and you want to like enjoy things and help people in the
Like
process.
anyone else.
Oh, dang. Okay, so what we'll do is, unless you have anything to add or you want to interject later on, we'll talk about the use of exercise and immunity. Okay,
Mhm.
so when we talk about the immune system, we oftentimes think of just the immune system, and for the people that are well versed in immunity, they think about white blood cells, to put it plainly.
Mhm.
But we need to simplify it, but also be specific. We need to think about what the innate immune system is, and that would basically be to our listeners and viewers. The innate immune system is what you inherit from your mother and your father, particularly your mother. So you'll inherit certain antibodies that will vaccinate you from certain diseases or infections that your mother may have been exposed. One of the most famous and notorious is the IgA, immunoglobulin A antibody. But that's just an example. It's usually considered to be your first line of defense. Its job is to attack foreign particles. Anything that it detects as being an enemy of the system, it's going to attack. All right. It will initiate the repair of tissue that may have been damaged or harmed. Okay, so it's in a way it's responsible for inflammation and swelling. It will inform and also modulate the second part of your immune system, known as the adaptive system or the acquired immunity. Okay, it makes up the physical barriers such as your skin, the mucosal lining of your lungs, your intestines, throughout your body. Your hair is also a part of that. Your nail beds are a part of it. Your cellular membrane is a part of that as well. The cellular membrane is very important. Most things in life are water soluble, meaning that they travel through water relatively well. But the membrane of your cell, of every cell in your body, has a lipid barrier. And we all know oil and water doesn't mix. So that fatty layer, that fatty outer layer, will prevent anything from penetrating it. Sometimes it does, but if the cell wants something to come in, it has a receptor for that, which is a protein that will kind of match together like a puzzle piece and pull it in. Okay, so that's part of your innate immune system. Macrophages, neutrophils, which are responsible for eating these foreign particles, are part of the innate immune system. You have dendritic. They produce degradative enzymes. They also produce cytokines. Not all cytokines are inflammatory. Some are pro-inflammatory, some are anti-inflammatory. And cytokines are getting a lot of attention right now because of COVID. So that's the big thing. And so again, that's going to be your macrophages and neutrophils, which is a part of your innate immunity. They also produce antimicrobial peptides. So peptides, little proteins that will basically scrub the outer layer of the cell and get rid of any bacteria or any sort of microbiota, microflora, viruses, protozoa, whatever may be present. They release reactive oxygen species and also saves you from reactive oxygen species. So those are the nasty buggers that destroy the cellular membrane of tissues. They release proteins that will signal the acquired immunity, and they will initiate inflammation. They're also natural killer cells, dendritic cells, mast cells, basophils, and eosinophils also make up the innate immunity. So it's large, it's huge. Getting a lot of attention lately. We've kind of ignored it for a while in medicine, and now we're paying more attention to it. The first line of defense for our immune system. You guys have anything to add to that or to mention?
No, it's pretty thorough.
Yeah, it's hard to add on to.
Okay. All right. Well, okay. Yeah. So there are the soldiers that stand at the gate to protect you. Okay.
Yeah.
The second part of your immune system is the acquired immune system. That's what you pick up in life from your experience and what you do. If you don't wash your hands, or if you apply the George Carlin method of hygiene, what was it called? Yeah, armpits, asshole, crotch, and teeth with one brush. In that order. If you swim in shit, aka the Hudson River, you'll get sick. Your body will be exposed to these harmful invaders of your body. And all they want to do is have babies. And in doing so, they damage your body. So your body will adapt to it and will develop mechanisms to kill it and to heal itself. And that is the acquired immunity. So it has a memory. And this is really cool. It has a memory of what it's fought. And so when it's introduced to that same bacteria that it fought 10 years prior, it's equipped, it's ready to go. Mm-hmm. And you may not even know it because you may not have a symptom.
Mm-hmm. Will it not also adapt to cohabitate with some of these invaders?
Yes, live in like a symbiotic nature.
Yeah.
That's exactly right. We're going to talk about that in a little bit. That has a lot to do with the gut, the big thing we talked about before, the microflora within the gastrointestinal system. So, yes, you're absolutely right.
So when kids are rolling around playing in dirt, is that beneficial for them? Extremely
beneficial. And this is part of like this weird idea, or people consider it weird. Make your kids roll around in dirt. Make them eat dirt. No, don't make them eat dirt. But by them getting exposed and you're not sterilizing them constantly, let them get sick so they build up an immune system. Mm-hmm. I don't want that to sound like anti-vaxxers. Vaccinations are still important, especially against some really dangerous viruses. But it is important to live in a symbiotic relationship with these in our environment and not be sterile.
It's really not an anti-vax. It's more of a vaccination argument.
That's right.
To expose yourself to nature, to outside, to organisms, as well as the vaccinations that we are basically exposing ourselves to these diseases in order to develop our defenses against them.
To develop the acquired immunity.
Yeah.
Right.
That's right. I mean, you can break it down as simple as you have one country versus another country. If they don't go to war, they don't know how to defend themselves. They don't know what to do to help themselves survive in the environment. And so if you live in a bubble and you're sterile all the time, you might be more prone to illness and sickness as well.
I had a friend in grade school who his parents kept a very clean house. You know, he was never sick as a preschooler. You know, he's very clean, very, bathed a lot. And then through grade school, he would get sick very often. He would get sick all through the winter and he would be out days at a time. And I think it was because he didn't have this built up acquired immune system when he was playing as a preschooler. You know, it's goes back to that. So
it makes sense. And if the mother was like that, imagine what she was doing to herself during pregnancy. So what kind of innate immunity did he have to be offered if she herself was sterile? Mm-hmm. This also goes to the concept of like allergies, peanut allergies, tree nut allergies in general, or allergies to dander or whatnot. And so what a lot of people do is they'll avoid eggs for a long period of time in childhood, or avoid nuts and peanuts for a long period of time, or avoid exposure to animals for a long period of time for a child. And then as a child gets older, they develop an immune response, an allergy. And then we say they have an allergy. This is contentious in medicine, but for the most part, it's the same concept. We started seeing more peanut allergies when we started avoiding peanuts for children. Whether or not that shows that that's a reason for the increase in the peanut allergy or tree nut allergy, we're not sure. It could certainly be that it's easier to diagnose, we're detecting it sooner, or many other reasons. But the idea that if you put someone in a bubble, they're not going to develop or adapt to it. Mm-hmm. Bottom line. And so what we say is, as soon as you can, as early as possible with whatever it is in life, whether it's having a knee replacement, start walking as soon as you can. You know, if you have a baby, breastfeed them, you know, and socialize them if you can. Don't put them in a bubble. And the reason is because it helps you develop a tolerance and an ability to adapt to that environment. If you're walking right away after a knee replacement, you're probably going to have an easier time walking, right?
Mm-hmm.
If you walk when you have pneumonia, you're going to have some pulmonary clearance, and you're going to have, well, we know, it's a fact. You're not going to have to be in the hospital that long, and you're going to be able to overcome that infection a little quicker, as opposed to somebody who lays in bed all day.
It points to the fact that, especially like after like a stroke, for instance, those first week, 2 weeks are essential, are so pivotal for the early recovery. You know, the first 6 months are really the biggest gains, but you can gain all the way up to a year or 2 years. But that initial training phase is so important in just developing that. Yeah,
you're totally right. So acquired immunity is adaptive. It's largely dependent on the innate immunity, and it's also dependent on your environment. It's called the second line of defense. It too will combat invaders. It is antigen specific, which means it's developing those special proteins, tools for cells that are being exposed to a virus or bacteria that's being killed. It develops those special tools to fight back.
Mm-hmm.
And that's what we look for when we're seeing if somebody is immune to something.
Yeah, and the most common illness that someone comes down with is like the common cold, right?
Right.
And we have the flu vaccine every year, and people may wonder, you know, why am I getting it every year after year? It's because there's not one specific strand of flu virus. It's always adapting and becoming different year after year. So I believe there's like over 200 plus strands of cold or flu virus, bacterial things that we can get infected by. That's why we keep getting sick year after year, because our bodies are learning one specific strand, but we can't fight off all these other strands. So it's a counterintuitive argument that the more we get sick, the stronger we get overall, because we're adapting to all of these different types of strands and
right.
Yeah, strengthening all of our different soldiers for battle.
Right, exactly. That's exactly right.
So we just released the vaccine for COVID, and we, even just before that came out, we're already seeing at least 2 new strands that have come out in the last month or month and a half of COVID. And it's like, well, yeah, we knew this is how these things evolve. So,
well, we tend to lose sight that life is all around us. For whatever reason, we don't even take into the consideration that viruses and bacteria are living creatures, literally living creatures, that if they don't adapt, they die, right? And their adaptation is built on the very fact that they need to utilize host cells or other cells to live. You know what I mean? So, of course they're going to adapt. And it's a different strand, but really it's almost like an evolution. And we oftentimes refer to it as microevolution, because macroevolution takes many, many years. But that's what that is. They're evolving, so their species doesn't die out. They too, like humans, want to spread their DNA and live as long as possible, and that's what they're doing. So, okay, so to finish the acquired immunity, the immune system. And both the T lymphocytes and the B lymphocytes.
So they both have like a memory component.
Yeah, your immune system, yes. And let's be even more specific. The memory isn't like lodged within the cell itself. It's a communication. A lot of times we refer to it in a number of different ways, but it's a communication of the immune system to other systems of the body. So we'll talk a little bit about the gut. The gut shares some crosstalk with the immune system. The CNS, the nervous system, also talks with the immune system, which is another way in which exercise is beneficial. So that constant communication, that's what memory is. The more the nerve, or the more the mucosal lining, or the more the T lymphocyte talks to other T lymphocytes, or to other cells like a neuron, the stronger the memory. Okay, just like muscle. The more a nerve talks to your biceps, the more memory you have in your biceps for whatever it is that you're going to do. Yeah, look at those guns. Like those guns here. Exactly. And that also determines tone, right? People that have good tone typically have good muscle memory or better kinesthetic awareness, perhaps. So you can kind of see the carryover with that, which I think is like really cool from that perspective.
So is that how exercise kind of ties into this whole immune system discussion?
Yeah, you're on track. It's multifactorial, but that's one of the ways. So when you are and then again, we're going to be specific about exercise. Exercise is not getting in the gym and just getting after it or going for a run or cycling. Doing something, a physical activity that you don't like, but you perceive it as exercise. Exercise is a supplement to physical activity. Really, the answer is physical activity.
Movement.
Move. Whatever you want to do. Yeah. If you want to dig in the dirt, because you're an amateur archaeologist, dig in the dirt. You're going to get a better immunity because you're physically active and you're also exposing your body. But
double whammy.
Right. If you sit on the couch all day and you don't move, and the only time you get up is to go to the bathroom, there is very little exposure to your environment, and you're not moving. So where's the talk? So yeah, you're right. So we'll start getting after that too. And that's actually a great point, because we know without a doubt, it's a fact, that if you do nothing, if you're not physically active, you have an increased risk for infection and illness. And because of that increased risk of infection and illness, you have a higher opportunity of death. We call that mortality. So you have a higher risk for mortality. So they
say nowadays that sitting is the new smoking.
Yeah.
So you're by sitting, you're just doing yourself a disservice. You're getting your body's not getting any stronger. You're actually deteriorating, essentially.
So that's not. I don't disagree with that, but there's a reason why they were saying that for a lot. Now they're kind of like tampering back on that. There has been some literature, and if I'm not familiar of new literature that's come out recently to make that argument, I'm not familiar. But the most recent literature that I have heard of argues that sitting is not the new smoking. That we are wrong in saying so. We're basically jumping to conclusions and making large assumptions. We know that smoking can cause cancer, not because of cause and effect necessarily within humans, but because of epidemiology, the relative risk. So what's the relative risk, statistical value within epidemiology? That if it's very strong, very high, and with smoking it was like 300 to like 500% likely, we can deduce that there is a cause and effect because the relative risk is so high. So that's where we make the assumption. That's where we can safely make an assumption that smoking increases your risk for cancer. However, when we talk about sitting, and there are studies that have looked at people sitting for 6 hours, 8 hours, 10 hours, 12 hours, the relative risk for cancer, heart disease, diabetes, osteoporosis, and all these other metabolic conditions, they increase, they do. But it's not at a point where we can say it's directly attributed. Does that make sense?
I think that is, so I think that makes sense. I think that, or maybe let me explain the way I'm perceiving that.
Yeah, go ahead.
We know that sitting isn't good because a lot of the times we'll see somebody get osteoporosis, or we'll see somebody have a pulmonary function decline or cardiovascular decline, but it's not necessarily all of those things. It's not all the conditions that they get. They might get one. Somebody else might not get what the first guy got, but he'll have another issue. And everybody kind of gets different, may get a different issue. And is it because of that variety or that disparity between A, B, C, and D complications that individuals experience that maybe they don't want to tie it to the lack of activity or tie it to the sitting to say that sitting causes this, and this?
Yeah, you just can't specifically say that with factual evidence, with cause and effect, that sitting in fact causes this health consequence, this health consequence, this health consequence. You can't actually say. It's the same thing as posture. Posture is an umbrella term. There's many different definitions of posture. Well, if you're sitting all the time, it ruins your posture. What definition of posture are you using? And does it? I would argue that humans are not meant to sit for long, long periods of time. That we are movers and sitters, especially when you look at us in survival situations. There are times of sitting, times of lying down. However, it's not for 6-8 hours on a computer, right? It's a different type of sitting. It's a different type of lying down. It's a different frequency. It's a different amount of time. But humans, for the most part, that we know of, are movers. So, but the assumption that it's like smoking could be inaccurate. And when you make those type of claims,
it's just a hard thing to claim. It's a little bit further out. It's another reason is it's a hard thing to study.
Yeah.
So having this prolonged sitting, like if they do a prolonged like bed rest study, not a lot of people are gonna volunteer for that. There have been studies where they look at 30 days of bed rest to simulate to study like astronauts because they don't have gravity. So they're doing.
You're talking about the Belgian study.
They're doing
the European Space Agency. They did bed rest. Yeah.
They're doing like 30 days of bed rest to see how this like non-weight bearing affected individuals, similar to like what space would be like, where they don't have weight bearing through their joints and
that was in the 90s.
I believe so.
It was in the 90s, and the European Space Agency, later with the support of NASA, I believe they're trying to replicate this study for a longer period of time. They had young men, I believe mostly men, college age, healthy, no comorbidities, no problems, lie in a bed
for 30 days.
For 30 days, they couldn't even get up to go to urinate. They had to piss in a pot.
Bed pain, yep.
Yeah, they had to shit in a pot, poop in a pot, do everything in bed. And they're just basically looking at what we call hypogravity. But what is the effect of less gravity on the body? So that way they can understand, space a little bit better. But they're looking at it from, okay, what happens to the bones? What happens to your circulation? What happens to your immune system? What happens to your cognitive function?
Muscular system.
Your muscular system, all these effects. And certainly enough, they had a number of conditions afterwards. They had difficulty walking. They had, you could argue, wobbly, wonky joints. They had a problem with fluid dynamics and circulation. They had an issue with immunity. However, that's lying down, not sitting.
It's just it points to the direction of sedentary lifestyle and across the age spectrum. You look at studies they look at sitting for 4, 6, 8, 10, 12 hours. But what if you do that for 50 years of your desk job? That's
a great example. That's a great, and hopefully we get some longitudinal studies like that. The worst thing that sitting does is it appears, and it's not a high relative risk, is that it has a higher risk for type 2 diabetes.
For a number of different reasons.
Of everything else.
Yeah.
Sitting has a higher risk for type 2 diabetes, and I want to also say cardiovascular disease, but I'm not necessarily sure about that.
But you could look at the English bus study of comparing the bus driver versus the ticket collector.
Yes.
And the bus driver had an immense increased risk of mortality due to heart disease, cardiovascular disease, stroke, all of these risk factors because he was sedentary. And the ticket collector.
Well, yeah, you got to be careful. You can't say because he was. You're driving cause and effect. It's correlated, or
way to keep me in check.
right. Well, no. I just, we just want to be accurate with it because if you say because, somebody else is going to be like, well, I was told that this, and this, and
but it showed evidence for. It supported. Right. It had evidence for.
Yeah,
I hadn't heard of that study.
It's a classic.
That is interesting. So it basically is just showing the bus driver who sat through the entire shift, most of the shift, versus the ticket taker who's on his feet,
up and down the
aisles.
double-decker bus.
Yeah.
Up and down.
But that's the argument, is that a less physically active job is correlated with more problems. But then again, you got to take into many different other factors in the lifestyle as well, which That's why you can't say because
Mhm.
it's possible that it is, but we need to repeat the study and be more specific, maybe.
Yeah, so this is kind of like one end of the spectrum where you're more sedentary, but then the other side of the spectrum is the exercise component. How does the exercise boost the immune system? How does it make you healthier overall? And I think that's what we're diving into here.
That's what we're diving into. So I think it's fair to say that we know that sedentary lifestyles increase your chances of problems, and physical activity in of itself might have potential to do many things, as I have notes here for. Should I start?
Let's do it.
Okay, so
We're just starting now.
well, we're recording.
So I was going to say, do I need to hit record or
Oh,
good? Okay, right? Yeah.
All right, so one of the first studies, Astrul Amatis research study done by him or her. They looked at Winster rats. They were all female Winster rats. They tend to do pretty well with cardiovascular exercise. They split them up in two different programs. One was a short intensive training session that consisted of it was 2 weeks long, and they trained them twice a day for 30 minutes at a time. And it was running on like a little treadmill. They call it a treadmill, but they're running. And at the end of the 2 weeks, they did an exhaustion test in the baseline. They did an exhaustion test at the end, and then of course they sacrificed the rats and looked at markers to see how did the immune system do. And what they found was that the immune system after that bit of training really didn't change. There was no difference. So, but again, that's 2 weeks, twice a day, which for a rat, that's a long period of time. They have a short lifespan. The second group was called a longer intensive training session. They trained for 5 weeks. Okay, so they're looking for a longer duration. They trained 3 times a week with 2 exhaustive tests as well. Okay, when they finished, they compared a final exhaustion test to the baseline exhaustion test, as well as an additional 24-hour test to see whether or not the immune system had changed. They also ran on a little treadmill, and what they found was that with the longer training session, that they had decreased phagocytic activity, meaning that the immune cells that eat the foreign invaders, which also cause inflammation, they're a part of the first stage of tissue healing, which we need to talk about in a second, actually, decreased. So you could argue that inflammation decreased because of that. It decreased cytokine secretion, which is also attributed. Remember, some cytokines are pro-inflammatory, some are anti-inflammatory. Most of them are pro-inflammatory. So it decreased that, and it also decreased the amount of reactive oxygen species. So what that means is, whenever you breathe, whenever you introduce a foreign particle through food or light, a lot of times you're introducing a reactive oxygen species with that material, with the air, with the food, with the sunlight, and that species, that little oxygen, is missing an electron. And what it does is, when it comes to a cellular membrane, it steals an electron from that cellular membrane, and that compound within the cellular membrane, that lipid layer, degrades. It keeps occurring. That reaction keeps occurring. So then another cell steals an electron, another cell, and it starts to degrade the outer lining of that cellular membrane until it's no longer viable, and the cell dies. And then that reaction continues. And that's the purpose of antioxidants and other nutrients like vitamin C, things that we consider antioxidants. What they do is they purposely sacrifice themselves. They give it an electron to prevent cellular damage, to prevent death, and in doing so, they basically transform into a substrate that we eventually flush out or recycle. Okay, so that's how that works. But longer training decreased phagocytic activity, cytokine secretion, and reactive oxygen species production. What it also did was it increased the natural killer cytotoxic activity, which is also, so it increased the innate immunity, its reaction to any potential invaders, while decreasing possibly pro-inflammatory systems. It's kind of cool, but it's in rats, right?
Right.
So we don't know if that happens in humans.
So basically, ready the defense system.
Exactly.
Uh-huh.
And at this point, let's talk about a couple of things as we continue. Let's talk about the stages of tissue healing. When you were studying PT and you were looking things up last night, how many stages of tissue healing did you come across?
Typically, it's several, but three to four main ones.
3 to 4, yeah. That's what I see all the time. I see either 3 stages or 4 stages. I like the 4 stages because it's a little bit more specific in my perspective, and I like specificity. But 3 to 4 different stages. So the first stage is, what do you think? You want to do this? Yeah, you did.
I can give it a shot. I can give this one.
Go ahead. For our listener out there.
Yeah. So the first one, inflammation. And correct me if I'm wrong, but inflammation.
Okay.
So you have that initial response, and your body. We always think of inflammation as being bad, right? But inflammation is actually the body reacting to that foreign substance or that stimulus that causes the pain or the whatever you want. So it's the initial stimulus. You have that inflammatory response. After that, depending on the severity of the infection or injury, you go into the proliferation phase. A couple days or a week after or so. Proliferation phase is the starting of laying down the foundation work to heal, to repair, followed by maturation.
Mm-hmm. Yeah. Remodeling too.
Remodeling.
Or remodeling, it doesn't matter. Remodeling, maturation.
Maturation.
Yeah, same.
To then rebuild, hopefully back as close back to normal as you can.
You're doing great, Caleb.
Yeah.
Don't worry, you're fine.
Struggling through this.
You're okay. You're doing great.
Am I on that? And then there's the fourth one. What's the final?
No, you're absolutely right. I'll expand a little bit on this. Joe, any words of wisdom, analogies, funny antidotes?
I don't think so.
I'll fuck something up in a second, and you can make fun of me for it.
Okay.
You're ready.
I'm ready.
Okay. So, that's the traditional 3-stage process that okay.
Got it.
There is no 4-stage after remodeling. So the first stage, if you're talking about specificity, you're talking about the hemostasis.
Mm-hmm.
All right. So the first stage, you sprain your ankle, which means, let's say, from an arbitrary perspective, you sprain a muscle, tear it. All right. That tear leads to bleeding. It's a circulatory response, right? You bleed and you start to clot. You clot to basically stop the bleeding from whatever arterial supply, the capillary, whatever it may be. And the clot is to prevent increased loss of blood flow from the circulation so that you don't bleed out completely.
Mm-hmm.
The second stage at that point is infiltration of inflammatory markers. So this is where the innate immunity system starts to work. So cytokines are produced by the monocytes and the monocytes and the natural killer, right? I just want to be sure. The neutrophils, I'm sorry. So, yes, the macrophages and the neutrophils start to produce cytokines. They leave the blood supply and they enter the peripheral tissues. Sometimes this is done in the blood supply, which also explains atherosclerosis as far as infection and damage into the internal wall of the blood vessel. But for purpose sake, we'll say you sprain your ankle, you tear a ligament or a muscle, first step is you bleed and then you clot.
Mm-hmm.
The platelets in your blood supply clot to stop the loss of blood. Then you have the innate immune system, those cells that we mentioned earlier, move in, they produce cytokines, they produce antimicrobial peptides, they produce, I already said cytokines, they produce a number of other of products like degradative enzymes. They start to eat the damaged tissue because it's no longer viable.
Mm-hmm.
It's just there, okay? It's dead tissue.
It's like the cleanup crew.
That's right. Clean it up. Get rid of it. This also occurs during autophagy when one fasts. Okay, so down the road we'll talk about fasting, but basically you're getting rid of the things that you don't need because your body wants homeostasis and metabolic efficiency. So you get rid of the damaged tissue. If there's any foreign particles there, get rid of them too. Okay, they eat them they take them into the lymphatic vessels and they ship them off into the lymph nodes.
Get them out of there.
Exactly right. Yes, exactly. And so then at that point, when you start to swell, those inflammatory proteins and cells that come in, your body wants to maintain a level of concentration within whatever system of the body. So it wants to maintain like a hydrostatic concentration. It doesn't want one area to be overly concentrated with a number of proteins, so water will come in. Now this is where it's beautiful. I think the body is absolutely beautiful. So it's multifactorial. You bleed, you already have platelets, it clots, boom, okay? When you bleed within your plasma, you have stem cells. So that little bit of loss of blood can theoretically release a little bit of stem cells in that area until it clots, to allow the stem cells to start doing, implantation, differentiating, start helping with the process. You also, when you bleed within that plasma, you have growth factors in there. You have other biological substrates that help with, you have some hormones perhaps, that help initiate the healing process, which is really kind of cool. When the inflammatory process is occurring and you have those proteins there, the water that comes in and swells, so your ankle swells, right? It gets black and blue. The black and blue is because of the blood that you lost when you were bleeding before you clotted. The swelling is there for a couple of reasons. One is it impairs your ability to move that joint, so you can't further harm or tear that tissue.
Interesting.
Beautiful, right? Also, what we have learned is that the edema is very rich in growth factors, cytokines, and stem cells. So the stem cells are now coming in to almost like a biological PRP to like try to help you heal. And you're certainly going to want to split yourself initially and to prevent further injury, right? So that was the second stage. The third stage is what you said before, is absolutely correct, the proliferative stage. Proliferation, and what that is, we talked about this before, the body's going to form a biological band-aid. You're going to release what's called granulocytes, and it's cells that are going to create tissue that's mostly type 3 collagen, that's going to basically close the wound, suture the wound, hold it together, be a physical barrier so you don't get infected, right, like skin. And it's going to also increase angiogenesis, which means the growth of blood vessels. And that increase of blood vessels are there to feed that biological band-aid so you can make it, but also, again, to bring in some circulation.
Mm-hmm.
And then it starts to heal from the inside out.
Mm-hmm.
That's
brilliant.
Beautiful. It's beautiful. And then the next stage is the remodeling process. You got the band-aid on there, you got some stem cells in there, you got some hormones in there, you got some growth factors in there, and next thing you know, your body's going to start to heal. And then famously, you had mentioned a second ago, we think of inflammation as a bad process, but it's stage 2 of the tissue healing response.
Mm-hmm.
And so a lot of times we try to squash it, and try to get rid of it, because you're right, it does hurt. And the thing I failed to mention was with inflammation, you get an increase in temperature. And the reason why you get hot with inflammation is because an increase in temperature kills foreign particles. So it's another way to prevent infection.
So side note, what's your take on icing?
Well, it depends on what you're trying to accomplish. A lot of times in physical therapy, traditionally, we say to ice an acute injury. The question is, should we? Should we take an NSAID too? It depends. It depends on how much pain the person can tolerate. It depends on what they're trying to do. They have to walk on that ankle? Can they? Do they need to? Are we going to facilitate tissue healing with ice, or are we just going to squelch it?
So I think at least my thought process behind it is when you have the initial injury, you're going to have an excessive inflammatory response potentially, and you're not trying to eliminate the swelling or the edema, but you are trying to manage it to an extent. Is that accurate or no?
You could say that it is, but who's to say that it's excessive?
I was going to ask the same thing. We would just talk about how beautiful and remarkable the whole system is. The fact that it does these things in order to heal. Is it really excessive, the fact that it's doing it? But I do wonder, in the case of somebody with who doesn't have normal circulation, has poor circulation, or a reason for the clearance to not take place as well as it would in a well-functioning body or limb, could that then become excessive?
That's what we think about in medicine. We think about, oh, you don't need to go through this type of this stage. We need to calm it down to help you feel better. It's really what it comes down to is we got to get you to feel better and get you moving as soon as possible, because we know that moving as soon as possible is helpful. But there is an opportunity there where you kind of have to say to the patient, all right, let's take it easy for a second. Give it some time. Let's just have recover. Your body's doing what it's supposed to do. I don't know if it's excessive. Nobody can tell you if it's excessive. I can tell you that another on the opposite extreme, we argue whether or not they get stuck. They get stuck in a stage and they can't go further. It's always inflammatory and it never progresses to proliferative.
Mm-hmm.
So what do? We try to kickstart it, right?
One thing we should note about these stages is they're not, you don't finish one stage and then move to the next one. It's a continuation.
That's
It's
right.
a spectrum. So you're constantly going in and out, or, gradually transitioning from one phase to the next. It's not just like a cutoff and then.
That's right. That's exactly
We
right.
go back and forth a little bit.
You can.
They kind of like feed, like as one process is been there for a little bit and coming maybe to the end, the midway of that, the other process already started. So there's a period of time when both processes are occurring. And then maybe you are moving a little bit and then, you injured it again and you restart. So he said it the right way. It's a continuum, and you're not just going from step 1 to step 2 to step 3 to step 4. And so that's where we kind of have to use our best judgment and clinical reasoning to determine whether or not we want to calm down the inflammatory process to help them, because maybe they are more in a proliferative phase, and we need to initiate movement to facilitate that phase.
Yeah. And we always point to, move, but the initial protocol is the RICE protocol, rest, ice, compression, elevation, to allow that initial stages of healing. But as we'll later discuss too, the exercise helps, as you said, facilitate moving on to the next stages.
That's right.
Exercise also can have pro-inflammatory components. So that's where you go back and regress into these stages before you can go back. So it's really tricky trying to find the right amount, the dosage of exercise, so you're not falling back into this inflammatory response.
That's right.
And you're progressing through the stages of healing.
Yes, exercise, physical activity stimulates your body to heal, but it doesn't heal you. It stimulates you. It breaks it down so you can build it back up.
Mm-hmm.
Well, if you broke it down and then you just exercise it to break it down further, it's not building back up. It's got more work to do. It's got twice the amount of work. When you rest and recover, that's when you build back up. I think it was Scott Walker I was listening to talking about sleep. Basically what we know about sleeping is that when you're awake, you're exposing yourself to low-level brain damage. And then when you rest, you're repairing that brain damage. But that's the analogy. When you rest, you heal. When you're active, you're stimulating. So that's that. But the point is that the innate immune system is active right away when you injure tissue. Okay? So that's pretty good. Now, let's talk about exercise. When you exercise, you can develop what's called DOMS, or exercise soreness. And for the most part, we traditionally think of DOMS as related to a release in substrates like lactic acid buildup, carbon dioxide buildup, nitrous oxide buildup, decreased glycogen or glucose, decreased energy, and increase in particles that either depress our pH level within the spaces between the cells or within the blood supply. And so we say, oh, you're sore because your body's buffering those metabolites. And that's not necessarily true either. What do you know about that? When you exercise, why do you get sore after or even during exercise?
That's kind of what I've always heard of.
Okay.
Is that buildup of metabolites, and it's you're trying to facilitate your body to get those out, to clear that area of that soreness, like stretching. And if you do like a heavy squat day and you're really sore the next day, they say like do like body weight squats or just a similar motion to work those muscles that you just worked to help facilitate the circulation to get those metabolites out of there.
Right.
We also talk about massage and, as you said, stretching. And
well, it turns out that may have a role, but it may not be the primary reason. So you have changed your pH balance within the system, which your kidneys are responsible, along with the lungs, and maintain the pH balance of the blood supply, which is typically neutral, right?
Mm-hmm.
Or a little higher. So you don't want to get too acidic, you don't want to get too alkalinic. And then your lungs, when you breathe, it also tries to balance out the acidity and alkalinity of the pulmonary function of your lungs. And they work together in harmony to kind of keep you relatively neutral,
Homeostatic. Yeah.
Right. So that may have something to do with the metabolites as well. So you're trying to buffer them. But the biggest reason, it turns out, or appears to be within the literature, is that when you exercise, again, you're stimulating your body. How do you stimulate your body? From a number of different angles. But when you're talking about the muscles, you're talking about the ligaments, you're talking about the fascia, those muscles pull on the fascia, pull on the bone, pull on ligaments and capsules. What happens is you're causing micro tears. You're breaking the muscle down. You know what I'm talking about. You're breaking the muscle down so when you rest and sleep and recover, you build it back up. And unlike on non-biological tissue, biological tissue works in the fact that when you break it down and it builds itself back up so it's better than it was before.
Stronger.
Bigger, stronger, faster, tighter, more flexible, whatever it may be. But it's better in the sense that it's not going to break down from that same thing that you just broke it down with. And that's how you get stronger with exercise. That's how your bones get stronger. So the concept is when you have impact exercise, you accrue micro fractures, which then repair themselves when you're resting to make it stronger, so that way in the end, you're less likely to suffer a fracture. Same thing with muscle. Well, if you're breaking it down, what are you doing there? Inflammation. You have an inflammatory response, okay? Mm-hmm. And that's the innate immune system coming in, increasing the temperature, having a little bit of swelling. Bodybuilders do all the time. They want to get a good pump right before they get on stage. So they try to express those tissues a little bit because they're going to swell a little bit. Or in the gym with bro science, we say, I'm swole. I'm swole today, all right? But it's the inflammation. So you're trying to basically buffer the inflammatory proteins. You're trying to basically recover from the inflammation process that you just put your body through.
Not to mention when you're using your muscles, you're working out, it's diverting that blood flow from your digestive tract, for instance, to those muscles to increase the circulation, to increase those inflammatory response to heal the tissue. So that's when you get also the swelling, what's it called? The transient hypertrophy.
Yeah. As well, and this is why creatine is so popular, because you need water, and it takes a water particle with it and helps you swell a little bit more, and it also gives you a little bit more a storage for more energy to be used for type 1 muscle fibers.
Uh-huh.
But so the bulk of delayed onset of muscle soreness most likely is due to a reaction to a systemic inflammation of that area. Okay? Until you recover and build it back better.
So with increased muscle soreness, let's say 2 days after a heavy lift, is that you're saying it's related to the amount of tissue damage that you caused?
Yeah.
So right. the heavier, more intense workout you had, the more soreness you have because of the breakdown of tissue.
That's right. The more
as opposed to the metabolites that are trapped in the muscle, for instance. Okay.
Yeah, and this is a newer thought process. This is not something that is necessarily being taught in school because it's new, and it takes a while for things to get into play. But that's where we're at. We're thinking that it's due to an inflammatory response by breaking down the tissue when you exercise, so you can build it up.
So tying this back in, it almost goes back to the discussion we had earlier of exposing yourself to, viruses, bacteria, to have a better acquired immune system. As the same thought process, you're breaking down your muscles, you're exposing it to these processes, this inflammation, so your body can heal quicker, better, faster.
That's right.
Right, you're taking on a challenge. You're putting your body through a challenging movement, activity to get it stronger, to make it stronger. And that
ain't nothing wrong with getting strong.
Nothing wrong with getting strong. Trying to get our patients to understand some of this concept, because it seems to me, to us, maybe relatively simple, that if we want to get stronger, we do something hard. A lot of people don't like doing something hard. And a lot of people fear that if they do something hard, they're going to hurt or be hurt from it. And while, yes, they may be a little bit sore for a few days, that is almost the goal. It's almost the goal to get to a point where you challenge your body enough to stimulate that healing. You have to take it down a little bit to stimulate that strengthening process, the whole, inflammation, rehabilitation process.
But the argument isn't about strength. We always say strength in our profession. It's really about resilience. You're trying to be more resilient.
It's getting the body used to, breakdown and recovery, breakdown, recovery, breakdown, recovery. It becomes more efficient in that process.
And the more you build it up, the harder you have to work to break it down.
Mm-hmm.
Because it's resilient, right?
Yeah.
And that's what
the plateau effect.
That's right. And that's why seasoned trainers, they're like, oh, I just wish I could get sore. You know what I mean?
Yeah.
Well, they train themselves to a point that they're able to handle a certain amount of stimulus. And the people that have never exercised a day in their life, they don't know what a squat is. They do 2 of them, they're like, oh, I'm done. For the day. but I mean, they're not resilient because they haven't been exposed.
It may not be necessary for the common person to constantly need to go through that continuous breakdown, regenerate, or recover, breakdown, recover, to tolerate normal activities. We're trying to just build that tolerance or build that resiliency to carrying the groceries in from the car, pulling out a pack of water or something from the car or from the bottom shelf to get it in your cart, lifting something like that without straining their body, without straining their back or their shoulder or something there.
Making it functional.
They should be functionally resilient. So in other words, if the tissue is only capable of handling 3 pounds of torque, but they need to apply 7 pounds of torque, they're going to hurt themselves. And just simple as that. If you can get them to develop a sense of resilience where they can handle 10 pounds of torque and they only generate 7 pounds of torque, they're less vulnerable to injury. Okay, and that's the point. And then, as you were saying, everything's a cycle. You have a cyclical metabolic system, a cyclical immunity system. Everything's cyclical. You have circadian rhythm is cyclical. There's a ton of different things that's cyclical. So although you don't need to keep putting them through this rigorous cycle of build up, breakdown, build up, breakdown, you do want to help them develop a sense of resilience so that they can grab the milk out of the trunk or a bag of dog food for their little Bichon in the house without them throwing out their back,
Mm-hmm.
or pulling their biceps or ripping their rotator cuff or whatever it may be. You've got to develop some resilience no matter what. And it doesn't have to be, we're talking musculoskeletal, or as Adam Meekins would say, musculoskeletal, yeah. But we're also talking about pulmonary function, we're talking about cardiovascular function, we're talking about skin elasticity, you can talk about dental hardness, you can talk about a number of different things.
Yeah, and this is like the macro scope of it. This is like where it gets to the functional level, but even on the micro level, that this is like what we're talking about, the inflammation and the stages of healing. Going back to the immune function of the whole thing, of just being able to repair better, being resilient, like you're saying.
Exactly right. So we talked about the stages of tissue healing. Now let's go to the open windows hypothesis. I think that's a good segue to go into that. Mm-hmm. What do you know about the open window hypothesis? Or do you? Or should I explain it?
No, I I've heard that with prolonged exercise. So what I've heard is like 90 minutes of aerobic activity, walking, running, cycling, that sort of thing, that you work your body to a point to where when you're recovering, you actually have a decreased immune function for a couple hours or at a time period where you're actually more susceptible to have exposure to an infection or bacteria or viral infection. So it's that open window. You have that open window of increased exposure.
Yeah, so
susceptibility.
Yeah, exactly. And this is a little contentious. There's a bit of a debate in medicine about this. And there is some clarity to it. It's not necessarily been shown either way to be true or not true. But the idea is, if you have a patient come in and you're treating them for whatever it is, let's say for back pain, and they're sick. They're not COVID sick. They're just sick. They have a cold.
Yeah.
My patients come in COVID sick.
COVID.
They have. They call me back later. Hey, someone's tested positive, and I wanted you to know I was there yesterday.
Mm-hmm.
Oh, okay.
I knew it.
I was having symptoms earlier.
Oh God.
And
what time?
But I'm like, okay. But yeah, go on. Sorry.
No. They tell you that I found out the day before, but I wanted you to know now. I forgot. But so you see this person, they're sick. You can tell they're sick. They're particularly, they just look like they're sick. What do you do as a physical therapist? Do you tell them, what do you do? What do you do?
Well, I think it depends on what their symptoms are. Typically, my rule of thumb is if it's above the neck, sinus, runny nose, those sort of symptoms, I think they're okay to continue exercising within the session. If they're having any sort of below the neck symptoms, muscle aches, coughing, trouble breathing, the lung inflammation or congestion, that's where I'm a little bit more, let's take it easy, let's rest, or that sort of thing.
Recover.
That's my rule of thumb.
Yeah. Yeah. And traditionally, Joe, what's the view in physical medicine as far as a patient is sick?
That's what we've done for years. We've said if they came in sick, that you probably better off just taking the day off or taking some rest and not exerting yourself too strongly, because we don't want to open that window to increase or to decrease your immune response to this sickness or this illness, and allow you to kick this thing faster. We don't want to prolong your sick time by weakening your body for this time.
And to explain that further, when you have that open window of exercise and it depresses your immune system, that allows the infection or whatever is making you sick to get stronger or more resilient. They start to make more babies, they become more abundant, they start to attack the body a little bit more without anything like defending yourself.
And that's probably because, sorry to interrupt, the body's more focused on repairing the tissue that you just worked. So with that exercise that you just did, and then you're more susceptible to this virus, it has more of a chance to proliferate. So
that's one camp, that's one thought process. So on one side, people are saying that. On the other side, what we're finding is that the immunosuppression after exercise is not true. What happens is you get a transition of the immune system. There's a transient effect. Okay? So let me see if I can find it. Yeah, so John Campbell and James Turner wrote an article about this. What they found was that with exercise, and it's particularly low to moderate exercise when you're not feeling well, it increases that immunoglobulin A, so IgA, okay, which again is part of the innate immune system. It's like a vaccination, okay? It also, and they found that to be true in particularly the saliva. They also found that there's a redistribution of the lymphocytes from the blood supply to the peripheral tissues, okay? And so when you take a blood sample and you look at the immune system, white blood cells in the blood supply, you see a decrease in the lymphocytes. And so we oftentimes attribute that to immunosuppression after exercise. That's not true. What it happens is the lymphocytes migrate from the blood supply to the tissues. Why? Because you just had some
You say
inflammatory
peripheral
processes.
tissues. Which tissues?
Whatever area that
specifically?
whatever area that you're predominantly working, it could
Okay.
be the arms or legs.
You're
It could be a whole. It could be it's systemic at the most part.
Talking legs, where they would be in the muscles, the quads, glutes, hamstrings. Those tissues.
Yeah, exactly.
Or more-
Outside of the blood supply into other tissues, like
Not integumentary tissues, or
it could be, but it's not within the blood supply.
okay.
Okay. And predominantly they're thinking that even though it's most likely systemic, it's most likely in an area that you're probably engaging, especially if you're being specific in a certain exercise, like squats, versus running that's working your entire body. So there's a migration of these lymphocytes from the blood supply into the peripheral spaces of the tissues. Okay. And so that looks like the open window concept, but it's not really true. And in fact, what happens, your immune system becomes heightened. It goes on like red alert. So it becomes heightened and it starts to surveil and regulate your body, okay, with more sensitivity. With frequent exercise, they found that the immune system also becomes more competent. So in other words, it's more efficient. It's more capable of like doing its job, okay, and more ready to enact change and to produce the byproducts, the substrates that it needs to help you overcome whatever it is that you overcome. It also limits and delays the aging of your immune system. So it helps your immune system stay young or younger. It enhances what's called the immune response to vaccination. So what they did was they took these people and they exercised them and gave them a vaccination. And then they exercised them again and looked at them. And what they found was that the vaccination had a stronger response in their immune system with the combination of exercise. So exercise allowed for that vaccination to work better.
Mm.
Isn't that cool? It's kind of cool, right?
It's something the public health sector left out.
No, but think about it.
They didn't tell us that.
Get the vaccination, but also stay physically active, right?
Yeah.
And also, if you're physically active, that kind of helps the circulation of the vaccination. It won't hurt so much.
Yeah,
Maybe
did
a
you
shot.
say that? Move your arm around. Make sure you move your arm today.
Yeah, totally.
It then also increases immunoglobulin G, immunoglobulin B, which are also vaccination, elements of the innate immune system. It decreases the severity of your infections and it increases your survival rate to those infections. Okay. They also found that it increases viral clearance, meaning that it decreases the viral load within the body and it gets rid of it right away, quicker. And then the other is that it decreases inflammatory reactions, not from the exercise, but decreases inflammatory reactions from the infections. Why? Because it's clearing it quicker and it's also killing it sooner.
Yeah.
So then they also found that T cells become more mobile, which makes sense because those are probably the cells that are leaving the blood supply and going to the peripheral tissues. And they also enhance the proliferation, meaning that it helps the immune system make more T cells for any type of immune situation. Pretty cool.
That's a lot. I mean,
It's a lot.
you think about, you're improving one area, but you're not just improving one area, you're improving 10 areas. You just named like 10 different things, so it's improving it tenfold.
And again,
in that regard.
Yeah, it's not just hitting the innate immunity, which is your first line of defense. It's also impacting your second line of defense, the acquired immunity, and it's multifactorial. And this is the beauty of like what you're studying, of what you're doing with your career, is that the body is multifactorial. Everything that the body does, there's more than one purpose for it. More than one purpose for it, and so it's absolutely, from my perspective, extremely beautiful.
That's an interesting point. If we can go back,
Sure.
That you said the white blood cells move into the peripheral tissue, aka the tissue that you're working, the exercise tissue.
Yeah, the spaces in between the cells.
Okay.
Yeah.
And so in the research, they're taking blood samples or saliva samples to test for this IgA, the immunoglobulin A, to look for the immune function, right? But if those white blood cells have already gone to the peripheral tissue, they won't be in the saliva or what they're testing.
Well, the IgA will be. The research initially for the open window hypothesis didn't necessarily look at saliva or even mucosal linings, where IgA tends to hang out. Okay, you have it embedded in those areas because again, it's It's a vaccination against invaders, okay? What you see though is that with exercise, the easiest way to do it is exercise somebody, then take a blood sample and compare that to the blood sample they took before exercise and see what happens to those white blood. Because we know in the blood, right, you don't have just red blood cells. It's platelets, stem cells, growth factors, cytokine, all these different things, white blood cells being a part of it. And so if you see a decrease in concentration of the white blood cells, the argument is then at that point, well, there's immunosuppression.
Right.
Which, in fact, you're not getting a clear picture because you're only looking at that circulatory system. When the immune system is not involved in just the arterial system, it's not just involved in the circulation. It's everywhere. So at this point, people are saying, okay, well, now we're finding that IgA increases with saliva. It also increases with the mucosal lining. Now we know that. But is there immunosuppression in the circulatory system? Oh, no. It's actually just a migration. So they're just moving. They're
That's
just
an interesting point.
moving to an area, most likely the area that you're working, because what would we say causes soreness? An inflammatory response. And what is responsible? What does the innate immunity do to the inflammation? If exercise breaks it down, breaks down the tissue, the stage 1 is the hemostasis. Stage 2 is inflammation. And stage 2, the innate immune system comes in and starts to eat the tissue that's damaged, get rid of it, starts to produce cytokines.
So it makes the immune system work.
Exactly.
It stimulates it. So,
Exactly.
Yeah.
And you're sore.
We should also note too that this immune suppression that was previously hypothesized was only in reaction to intense, high, vigorous exercise. It wasn't in low or moderate exercise levels.
Well, yes, and we actually have some literature on it too. But so exactly, yeah. And so the innate immune system comes in during an inflammatory response. That's why a lot of times when you're not feeling well, when you're sick, you're a little sore. Kind of similar to being sore when you exercise too. You get those muscle aches. So you can see that there's a shared response there possibly. So when you exercise, your immune system perhaps is just ready to go. It's been, command center called it up and said, hey, listen, get the fighter pilots ready. Let's prepare the battleships. Let's get the Marines, in step and prepare the army for invasion.
So really this exercise thing makes you proactively better for your ability to fight infection, but similar to taking a daily vitamin.
That's right.
This is like your exercising is your daily vitamin essentially.
That's right. That's a great way to say it actually. It's like a daily vitamin.
Yeah.
That's perfect. Okay. Well, let's move on here. So we've got that part. Now, there is some literature that basically shows that low and moderate intensity exercise, meaning that the intensity of the exercise is less than like anywhere from I want to say 75% or less, or even 50% or less of the intensity of the workout. That's more appropriate for somebody who's not feeling well. So that heightens the immune system without causing too much of an inflammatory response. It decreases inflammation and it allows them to overcome the infection. But again, to go back to your point though, with high intensity exercise, 75% or higher, even 90% or more, if you're redlining the system, you are going to incur more cellular damage, which causes inflammation. So your immune system is going to have to do two different things. It's going to have to help you in response to repair the tissues that you broke down, as well as fight any sort of foreign invaders. So it's not that it's suppressed, it's just that it's busy now. It's got two different things to do. It's being flanked. So it's got to fight on both fronts. Okay?
Interesting.
So that's the idea. So from a provider standpoint, you have a patient that comes in, they are there for shoulder pain, and they have a cold. Light to moderate exercise will do them no harm. If you send them on their way because they're sick, you're really doing them a disservice. Not just from their shoulder pain, but also a disservice from the fact that they could better fight the infection with a little bit of light. And you don't have to do it that long. You could probably shorten the session. Just give them some low intensity to moderate intensity exercise, and it'll help them.
Can we try and define what low and moderate intensity exercise is for either the low A person or the provider?
Yeah, that's a tough one because a lot of different literature goes back and forth on what that is. They talk about heart rate. They talk about the intensity again. They talk about, you basically shouldn't be out of breath. Shouldn't have that effect. And you also shouldn't have that effect to where you're like, oh, I just can't get, you're fatigued and you can't go any further.
Mm-hmm.
It should be enough so you can still talk, but maybe it's a little difficult to talk. But afterwards, you're alert but not exhausted.
Yeah. So for my patients, I like to oversimplify it and just go, your 1 to 10 RPE scale.
There you go.
Rate of perceived exertion. So you want to stay within that 4 to 6 range for moderate
Or
exercise,
less.
and then typically that 3 to 4 for low activity.
That's right.
With 1 being kind of your baseline.
That's right. And as far as the time is concerned, you can do bouts of 10 minutes, or you can do 20 to 50 minutes of continuous work if you want. But you don't have to do an hour. You don't have to do 90. A little goes a long way.
Yeah, and then also telling your patients, an easy way for them to gauge it at home how intense their exercising is. You want to be able to talk while you're exercising, while you're walking, but you're not able to sing.
Yeah, that's a great way to say it. What did you say? What were you going to say? I thought you were.
I don't know. I don't remember.
You can't sing?
Well, I was thinking about when I'm running, and I've been pretty much engaged in conversation through a 5-mile run, but not able to sing. I wouldn't be able to sing. Definitely, there's times when my sentences get shorter.
Mm-hmm.
I cut out some of the words that aren't really needed. But
less word do trick.
Yeah. But it's been a good gauge for the training.
Yeah, that's would be moderate intensity, and that's good to give your patients to help them gauge it at home.
Yeah. All right. Some literature by Stephanie Francois Berman and Andrea Tennessee, as well as their colleagues, and these are 2 different studies. They agreed upon, and they basically found that when you exercise, you decrease the pathogens in the gastrointestinal mucosal layer, and also the circulatory system. So what that means is you're decreasing the amount of invaders in those spaces. Okay, you increase the biodiversity of the gut lining. So we're going to talk about the microbiota, the microflora of the GI tract. And so that microflora, all the good microflora, becomes more biodiverse, which is a good thing for you because it helps you on so many different levels. And this is a huge topic of research with exercise as well as nutrition. So when you exercise, you create more biodiversity. And what happens is that your adaptive immune system becomes more sensitive but starts talking to the mucosal bacteria and the mucus of the tissue. Okay, your immune cells. We talked a little bit. Joe and I have talked about vitamin A a little bit. You have T lymphocytes right within that lining. Your immune system hangs out right behind your gastrointestinal system, right behind your intestines, right behind your stomach. So a lot of people who have back pain, sometimes it's not because of legitimate back pain. Sometimes it's because they have a problem with their intestines, like leaky gut, and the immune system is attacking nutrients that are getting through the gut lining and causing an inflammatory reaction, which spills over into the spine. Okay, and it's perceived as low back pain. So, and this is more conceptual based; it's not necessarily proven yet, but through functional medicine, that's the thought process. So, when you exercise, you're strengthening that biodiversity of the microflora. You're increasing the communication of your immune system to that microflora within your gut lining, as well as the mucus. You help it protect. The microbiome is then protected from inflammation. So your immune system purposely protects the good bacteria from an inflammatory process that would otherwise kill it. Because again, when you have inflammation, you get increased temperature. You get things that come in that eat it. You get things that come in that enzymes that will degrade and kill it, and your immune system will protect it from that. It's able to differentiate that's good bacteria, that's bad bacteria. And we're going to keep this guy alive, but kill that guy, because that guy right there is going to help us, live.
You don't want to kill the civilian.
No, that's right. It also increases, again, immunoglobulin A, and as well as immunoglobulin E within the mucosal lining. Okay, which again, it's like a vaccine. These are vaccinations, so it can help block those foreign invaders that are with nefarious intent, trying to get through the wall. Trying to get through the wall, Joe. Build that wall. No.
I think we put it up. We're just probably about to break it back down.
Yeah, I think so.
Then we'll put it up again.
Make it sticky, like the mucus. So exercise will activate the immune system by increasing the basophils and the mast cells that help you with allergic reactions, especially when you're talking about food intake, right? Peanuts, remember? It also helps protect the lining of the intestines, the lining of your stomach. Or you have epithelial cells that line that create mucus and such like that, and they protect the microvilli, which help you break down and absorb nutrients. So your exercise will help activate the immune system so it can better protect the outer lining of your gut. All right. It also, again, creates those antimicrobial peptides that are released into the gut to basically prevent anything coming into the cell, sticking to the cell. It scrubs it, cleans it. It's like sanitizer. The immune system releases some sanitizer so the microvilli can rub their fingers together, because that's a nutrition joke. They're like little fingers.
Yeah.
And so they clean their fingers, and you're less likely to get sick.
Interesting.
Isn't that cool? Okay, let's go here. So it also promotes microflora and immune system crosstalk. We talked about that. So they're communicating. You're talking about foreign entities, good bacteria, good viruses, good protozoa, good microflora, talking with your immune system saying, hey, not me. I'm working on my visa here. That guy's the one that came through the wall. He's the one with the drugs, right? And he's got the fentanyl. And so your immune system can go get it and it protects the microbiota. It releases hormones. So as it's talking to the microbiota does many, many things. It will start to facilitate the release of hormones and neurotransmitters to better communicate with the rest of your body, from an inflammatory reaction to immunoprotection and tissue healing. It also, and so that's through like dopamine and serotonin and GABA, and then or gamma, and then it also synthesizes the microflora will synthesize butyrate, acetate, and propionate, short chain fatty acids that we would otherwise have a hard time getting from our foods, so that our body can absorb and use them as nutrients, especially the cells within the GI tract. So they say, listen, you protect us, we will produce nutrients that you have a hard time protecting. So we live in symbiosis. Ain't that cool?
It's nice.
And that's why Border Patrol protects them. Okay, so Zane found that regular exercise, so he looked at people who participated in regular exercise versus sedentary behavior, so sedentary control. He found that they had no significant changes in cytokines. Cytokines, remember, the majority of them are pro-inflammatory. So the exercise group and the sedentary group did not have a difference in cytokine production. He also found that exercise decreases the T cells and natural killer cells within the peripheral blood supply. So again, most likely they're migrating to the peripheral tissues. All right. They do increase, it's going to be tough here. I don't want to go into too much detail because I don't want to confuse people, but it's called interferon and a tumor necrosis factor, and interleukins, which are cytokines that are secreted by your peripheral blood. I'm trying to think, I can't remember the acronym. They're made to basically. They're made basically to help you fight off foreign invaders. They and he found that they increase with exercise when they purposely infected somebody and they heated up strep to basically be activated, so it would do its damage, and the exercise protected them from that by producing those. But when they didn't do that, it didn't respond that way. So it didn't just have an immune response just by exercise, and had an immune response when you exercise, when you had those, when you were already sick.
Not sure that I'm following there.
Okay.
I'm trying.
All right. So basically, these subjects, trying to remember the acronym here. They basically had, I believe it was streptococcus, and they had an additional. Oh, that's right, hepatitis B. Okay, and what they did was with the streptococcus is that they heated it. With I can't remember how they heated it, but it was heat activated, so that way the streptococcus could then proliferate and do its harm.
Sure.
And those individuals exercised, and what they found was when those people who were infected, who were already infected with those issues, they didn't infect them and then exercise; they already had the infections. When they exercised, the body produced certain cytokines that combated and killed that infection. Whereas people that were sedentary did not.
Okay.
So in other words, you're sick, you exercise, your body's going to respond, not just respond to attack the infection that you already have. Kind of what we already talked about before. Okay? In a specific manner. It's like, again, we talked about exercise activates the immune system and puts it on like high alert and surveillance. So all of a sudden, those guys you're already sick. Your immune system might be aware or maybe not really aware. It's a little groggy. You exercise, and all of a sudden it's like, oh shit, it's over there.
Kicks into the gear.
Kicks in the gear. Mm-hmm. And then he also found that that increased cytokines by the dendritic cells when you were sick as well. So it was cytokines with that have interferon neuron alpha, interleukin 12, interleukin 6, neurofactor alpha, interferon neuron gamma as well, were basically kicked into gear to fight the infection. You also had an increase in what's called toll-like receptors. Toll-like receptors are basically things that the immune system uses that tells the acquired immune system to do its job. Remember I said it activates, it stimulates the acquired immune system to do its job? That's how it does it.
Okay.
Okay? So when you're sick, what saying is when you're sick and you have an active infection and you do some exercise on a regular basis, your immune system kicks into gear and starts to take care of that shit.
Low intensity exercise just to get things moving.
I didn't go into it with the exercise with them, but so I couldn't tell you exactly what type of exercise they used, but so I don't know that, but just like
typically
yeah,
low intensity
moderate, yeah.
aerobic exercise gets things moving, gets things flowing, all good things.
So in Shabab M. Al-Qader found that resistance training and aerobic training, not together necessarily, but as two different modes of exercise, they both increase your immunity. So you don't have to go for a run to improve your immunity. You can actually lift weights. And you don't have to lift weights to improve your immunity. You can go for a run or a bike ride or a walk. They both, anaerobic and aerobic, will affect your immunity and decrease your inflammation. Now, the decrease in inflammation was stronger in the aerobic group, which I thought was interesting.
Yeah.
But that's what he found. Koch.
I do have to go soon, by the way.
Okay, how much time we got?
It's like 12:30.
Okay. Well, let's go through this real quick.
Okay.
Koch found that with exercise, you increase epinephrine, you increase norepinephrine, you recruit lymphocytes, you activates the sympathetic nervous system, which then activates your innate immune system. And that decreases the tissue damage from exercise by activating your immune system. So again, when it migrates, it might be helping you helping you recover from that exercise, that breakdown from exercise.
Yeah, it could also lower your DOMS then, as we said earlier.
Well, that's one reason, like when you're talking about, if you're going to be sore after exercise, don't be sedentary, move, right? We thought because you're buffering metabolites and increases circulation, but it might also be because it helps you,
With the
heighten that
function.
immune system and
Yeah.
help you exactly. Giselle Soares Bezos, she found that moderate exercise over the long term improves one's ability to sleep, which helps you with the recovery.
Mm-hmm.
It decreases cortisol production, decreases depression, increases your immunity by promoting anti-inflammatory and anti-atherogenic changes. And then finally, I want to go through this real quick. There is a downside. If you overtrain, either with anaerobic or aerobic work, you can cause inflammation, which is harder to recover from. And for certain populations, we talked about this earlier, certain populations are harder than others. You can cause a dysbiosis, which means that you can impair if your immune system has to do two different things, address the inflammation caused from the exercise, as well as the communication from the gut. If it's doing both of those things, it means it's going to talk less to your gut, and therefore its ability to help the gut is less, right? Because it's doing two different things. It's not good at multitasking, I guess you could say. So if you overtrain, you can decrease your crosstalk between the mucosal lining of your gut and your immune system. You also have, you can increase the cytokine production that can cause more tissue damage. Okay, so think about that in rhabdomyolysis, right? Rhabdomyolysis is a serious condition where you break down the muscle cannot repair itself. And then you have this increased buildup of potassium, which can then cause pulmonary and cardiovascular distress and failure. So it's basically a result of inflammation, systemic inflammation that you can't recover from.
I think this also goes into like the overtraining, like you said. Like let's take a long distance runner, for instance, who is running quite a bit of miles and develops, a Achilles tendonitis or some sort of tendinopathy where they don't give their body enough time to heal itself. So they're in this constant stage of inflammation, and there's never time for a recovery phase, and you get into this cycle here.
That's right. That's exactly right. If you're producing a lot of cytokines to help with the inflammation, some of the cytokines are pro-inflammatory, you're going to eat up that tissue and not recover, and you're right. The other thing, too, is that what they found, too, in athletes particularly, that overtrain, they are more susceptible to upper respiratory tract infections. But think about it. If they're constantly going, and they're like sucking in wind, you're sucking in not just air, you're sucking in like potential invaders.
Not to mention you're around like other teams, other players. You're cross contaminating all of that.
And it's usually high intensity exercise, so you're facing an inflammatory condition, and that's where maybe that open window perspective may not be exactly 100% true, but there might be some legitimacy to it, and the fact that you may have an opportunity to be introduced to an upper tract infection. Mm-hmm. So that's all I have. Do you have anything else that you want to talk about, or anything else?
I would just say, that was a lot of good micro detail of like how exercise boosts the immune system, but from a macro scale, you kind of briefly mentioned it in that last study of how it, decreases depression, helps you sleep, all of these things that help you in a day-to-day. So exercise does give you a quick boost of energy. You may have more energy to cook a better meal. You might be more inclined to eat healthier. That comes into the whole nutrition aspect. So, and exercise can help you sleep better, the recovery process better. It just has so many functionalities, not even micro perspective of your white blood cells, but your macro perspective.
You feel good because you're releasing health hormones that make you feel better.
Dopamine,
Yeah, dopamine, oxytocin. Oxytocin makes you feel great, okay? Mm-hmm. And a positive response. When you don't exercise, you're more likely to produce cortisol or catecholamines, which can make you feel kind of crappy, and they're pro-inflammatory. Oxytocin is an anti-inflammatory. You also improve the central nervous system's ability to communicate to the body, and therefore utilize that memory and that neurological effect to take care of itself. But the point is that does exercise help with immunity? If I ask, and I've asked this question to providers, I say, does exercise improve immunity? They say, yeah, sure it does, of course. Everybody knows that. How? Why? They can't tell you. it's hard to tell you the detail. They probably learned it, but they haven't had to express it or utilize it. And so the purpose of this topic today was to really dive into the details so that if you are that person that likes the detail, or if you want to know exactly why, or if you are using the open window hypothesis, you might change the way you practice. Or if you are an athlete training or a person that's trying to get healthier because of COVID, you might change the way you train to help yourself, and you might have some motivation to go do it.
Mm-hmm.
So that's the idea. That's the idea, and we want to educate and inform and hopefully transcend the ideas of exercise for immunity. And so now, if somebody says to you, "How does it help? Why does it help?" You may not need to go into detail, but you could certainly give them like a quick summary from hormonal, neurological, to the gut lining, to innate, to acquired.
Hit play on this podcast episode. Show them that one.
Well, okay, so Caleb's got to go, so we're gonna probably end this. The last thing I want to do is, again, I want to send a shout out and a thank you to a few people that have inspired this podcast. We've been sitting on it for a couple of years. And if it wasn't for these individuals, we probably wouldn't get going. So I want to say thank you to Joe Rogan, Sam Harris, Sean Carroll, and Adam Meekins. Those guys. Hopefully I'm standing on their shoulders and I'm doing them justice. But I'm very grateful and honored to do the podcast. And if it wasn't for you, I don't think we would be inspired to do so. The other thing we want to talk about is, before we go, is that although we plan on keeping this free for everybody, if there's an opportunity to monetize this, or if you feel compelled to donate to Patreon to help us continue to keep this podcast alive, or if you think that just by subscribing and listening to it for free is enough, that's fine too. We need as many subscriptions as possible to achieve that. But 25% of any monetary proceeds that we receive will go to cystic fibrosis, will go to muscular dystrophy, and also go to spinal muscular atrophy. So we will be donating that money to those charities to support children that will hopefully, with our technology these days, never have to deal with the signs or symptoms of those conditions, and help those that unfortunately have been a victim of those congenital disorders, and maybe also improve the research. So we want to make sure that you understand that that's something that we really care about, and we plan on donating that monetization to those charities. So I appreciate your time today. Thank you very much for listening. Caleb, awesome job. I appreciate everything. Thank you very much.
Thanks for having me.
Yeah,
You're
thank
welcome
you for
back
coming in.
anytime.
Awesome.
Pleasure.
Welcome back anytime, right?
Anytime.
All right. Well ended. Take it easy, buddy. Thank you.
Awesome. Thank you so much, guys. That was fun.